Oops. Hi everyone, we're going to get started. So my name is Katarina Reed, and this is Stony from University Libraries. And on behalf of the library's Diversity, Equity, and Inclusion and Accessibility team, we'd like to thank you all for coming. Today's event is supposed to celebrate Filipino American History Month, and for those of you who don't know, Filipino American History Month has been celebrated since the 1990s and was officially recognized by Congress in 2009. So today's panel is going to talk about the experiences, the lived experiences of Filipino nurses in the United States. We'd like to introduce our moderator, Neri Sabalse, Associate Professor of Asian and Asian American Studies here at Stony Brook University. Okay, I'm going to pass off the mic to Sunny.
All right, can you hear me? Okay. So our panelists are Lani Blanco, clinical instructor from the School of Nursing, Maria Bune, adjunct faculty from the School of Nursing and Stony Brook alumna, and then Sophia Reyes, who is a clinical instructor from the School of Nursing and the director of simulation education. So for everyone with us on Zoom, please keep your mics muted throughout the event, and please feel free to add any questions into the chat or use our Padlet, which Jamie will share in the chat. All right, I'm going to turn things over.
Okay, good afternoon. I hope I'm clear for the folks here. As we say in the Philippines, magandang hapon po sa inyong lahat. Good afternoon. We are very delighted to be here on this day celebrating Filipino American History Month. So we have some themes for our panel discussion today. I will be guiding the conversation. I'll ask the question, and then our panelists who are here today, who are nursing professionals, they will be talking about their own experiences and their own expertise, how their lives were shaped by personal as well as their academic interests in the field of nursing. So we're going to, I wanted to start off by sharing something before we have our conversation. I did want to talk about the topic at hand, and this is the women and men of the medical profession, and how Filipinos are very much impacted by the pandemic. And so while we are here to listen to our panelists, I'd like us to think of the reality of what has happened since the pandemic. And this is from a ProPublica article. At least 30 deaths of Filipino healthcare workers since the end of March 2020. And many more deaths have happened. And so this is part of the context of our conversation. We are a community that has been deeply impacted by COVID-19. So with that, we will now discuss actual lived experiences of nursing professionals. And we'll start off with the question about all of us here, I think, on this panel have immigrant backgrounds. So why don't we start off with the question of why the nursing profession? Why did you choose the nursing profession? So maybe we can start with Lan.
Sure. All right. So I am Lani Blanco. I graduated from Stony Brook University in 2002 with a degree in nursing. And the reason why I think I was cleaning out my house recently, and I found a letter that I had wrote when I was in 3rd grade. And every time you always have to write about like what you want to be when you grow up. So it said, when I grow up, I want to be a nurse just like my mother and just like Florence Nightingale. I know, like, what 3rd grader goes to Florence Nightingale? So I was, I think my family had a really big impact on me on wanting to become a nurse. As a Filipino, you have a lot of family members who are in the healthcare profession. So my mother, my aunts, my cousins, my uncles were all nurses. So I think I just followed in their footsteps.
Hi, I'm Maria, and I'm a Stony Brook alumni as well. Graduated in 1991, just me a little bit, but again, I chose nursing again because it was a parental decision. My parents wanted somebody who would help the community and help other people, other families. I wanted to be an actress, so that didn't pay very well then, and it's probably not paying very well now. But again, I fulfilled my parental dream of having a child who helps others, and it kind of, you know, helped me very well as well, because 25 years is still hearing from, you know, from others, and I like the fact that nursing is very flexible. So I've done pediatric to adult to geriatric. So that's the greatest thing about that, and a big difference between what my other cousins who are in, again, the Filipino families, we are in medicine. So a lot of them are doctors too, but they're kind of stuck in one spot, you know, where they're either orthopedics or surgeons or you know, in one or general physicians. But nursing, we can do so many things. We can go from pediatric to adult to you know, community health to hospital. So that's one of the things that I really like about nursing as well. That's what attracted me to the fact that I can be flexible.
I actually have no idea how I became a nurse. I really don't. My parents are surprised, my whole family's surprised. I'm actually one of the very few nurses of my family friends and of my family, which is rare. I was actually born and raised in Brooklyn, and when I was 3, apparently there was a picture on the wall, what do you want to be when you grow up? And they put a little nurse with a hat. I have no idea why, but my mother is a nurse and worked down the street from the daycare that I was in. So she worked nights, she would bring me to school every morning, we'd stop by the food truck and go there. But because of the lack of childcare back in the 80s, they were like, hey, let's bring you to the unit. So I used to imitate the telemetry machines, the monitors, tap on the screen. And be like, hey, look, I can do that too. So I believe it was put into me for years, but I have no idea why I actually became a nurse. And then I ended up loving it once I was more exposed to it and understood actually what went on with it. And I did graduate in 2008.
All right, again, just because I'm someone who teaches courses in Asian American Studies, I wanted to go back to, again, some data or some facts about nursing and Filipino American life. Today, this is from Women at the Center, an article entitled Resilience and Community Filipino Americans Nursing and COVID-19. Today, 90% of nursing jobs in the United States are still held by women, of which an estimated 4%, about 150,000 total, originally hail from the Philippines or are of Filipino descent. So keep that in mind. You know, we represent a good number in this profession. Despite the small number, Filipino nurses have been disproportionately affected by COVID-19, accounting for over 31% of fatalities among nurses. So with that in mind, let's go to another question that has to do with education. What is your educational background? Maybe you can talk about how many years you practiced as a nurse. Perhaps the classes that are memorable for you, maybe something that stands out, or also something that is not very pleasant, maybe something that you would have liked to have known when you were taking classes. And did you join any nursing related clubs that helped jumpstart your career or help you network? So anyone, it doesn't have to be in order, you can just decide on how you want to answer the question.
I guess I'm going. Class of 96, and I was the president of my class, but I didn't have, how many students do we have now? 80. My class was, I think, the most 30. So it was a really small class, so they had the most talkative person to be president. And So yeah, that really helped me severely because I was able to go and really expose myself to so many different types of healthcare, as well as they actually at one point they sent me to Albany to represent my class. I don't know if you do that now. Yeah, you do still do that. Yeah, we don't do that anymore. But yeah, so nursing and being the president of my class was really a big help as a new a new nurse actually, to really try all the different aspects of nursing. And I'm still trying mine. It's great. The great thing about nursing is you can go and try all the different things out. So it's really exciting.
So when you're in nursing school, you have the opportunity to be exposed to so many different areas. So, at the end of nursing school, you have to start deciding like, what kind of area do you prefer? Where do you want to work? I really didn't know. I didn't know what kind of nurse I wanted to be yet because I wanted to be everything. You want to be a nurse because you want to help people. I had a long background of volunteering. I volunteered in the daycare center here. I volunteered at Child Life at my former Sloan Kettering. I volunteer with my church. So, I really just liked helping people. So as I went through nursing school, I looked at all the units. We did mother baby. We did med surg units. I did some time in the ICU, and the psych unit, labor and delivery, you name it. We did them all. And I still was like, I don't know. So I had the opportunity to do an internship in between junior and senior year. And everybody was like, oh, I want to do care. I want to do pediatrics. And I was like, I don't know. So let me just pick whatever's left. So I ended up in the burn intensive care unit here. Let me tell you, you guys are surprised, but it was the most amazing experience that I've ever had. So that's why when I graduated from nursing school, I ended up working in the burn intensive care unit at New York Presbyterian. I was there for about 6 years, and then I said, the beauty about nursing is that you can really go anywhere, you can do anything. So then after that, I branched out and went to the hospital across the street, and I did orthopedic nursing. So I worked in the PACU for a little bit, and then as I was, as you work as a nurse, you have the opportunity to teach a lot. You teach your patients, you teach their families, you teach new nurses, other nurses that are coming from other units to work in a new place. And then I realized that I love teaching so much. So then I went back to school for nursing education. So from Stony Brook, I got my master's degree at Columbia University, and then currently I'm working on my PhD at Delphi. I'm a true lifelong learner. I highly suggest that everyone do. You know why? Because when you're a nurse, you learn every single day of your life, whether it's from patients, families, any procedures or anything like that. So honestly, I think that that's the beauty of nursing. You're always learning. You're always meeting different people.
Is anyone here from Pre-Nursing Society? I was president my junior and senior year of my pre-nursing people, so just thank you for everyone who's better watching as well. So that actually was how I was exposed to how to be a leader. However, I was like, oh, I'll be a high-powered leader one day. It didn't turn out that way. I actually went back for my degree as a nurse practitioner. I unfortunately learned the good and the bad aspects of how healthcare has become very business-like in the last 10, 15 years. I enjoyed my time being a nurse practitioner in private practice. I was also a student health services nurse practitioner and in private practice as well. Still do that once in a while. However, I got a call. Hey, do you want to be a clinical instructor? I said, okay, I'll try it out. Turns out I really, really love that. And I actually went back after being a clinical instructor for a few years to get my postmaster's in nursing education. So I do have that degree as well. And then during the pandemic, I was like, I am not very happy right now. I loved it. I was actually one of the nurses who were part of that great resignation of nurses who left post-pandemic. So I was here in this hospital in the ICU for both rounds prior to my resignation. So I ended up at School of Nursing as the director of simulation. I wanted to change the perspective of being more prepared going into any type of pandemic or any type of healthcare, whether it's outpatient, inpatient, or if there is another mass disaster in the future. I want all of the students to feel prepared, like we are getting ready to go in. Yeah, so that's what nursing has taught me in the last 15 years.
Right, so we'll move to the next topic. But before that, again, I wanted to read some articles that have covered the nursing profession in the last few years. So I'm reading again from the ProPublica article of Nina Martin and Young, similar to times of war, the staggering toll of COVID-19 on Filipino healthcare workers. And this is from Martin and Young's article. The story of Filipino nurses in the US goes back further to the end of the Spanish-American War in 1898, when the Philippines became a US territory, said Catherine Ziniza Choi, a professor of ethnic studies at the University of California, Berkeley, and author of Empire of Care, Nursing and Migration to Filipino American History. One legacy of the colonial era is a network of hundreds of Americanized nursing schools that eventually produced tens of thousands of caregivers a year, making the Philippines, the country, the leading exporter of nurses in the world. Nursing offered an escape route from economic and political instability and a path to the middle class for those who had few other options. So just to tie our discussion of education, and now we are moving to another theme, which is professional on professional narratives. I think that this is number 3, right? So the questions that I have in that we agreed for our panel, did your career choice or path change over time? What do you like about your job as a nurse? And what challenges do you face? What was your favorite job as a nurse?
Oh, my turn to start. My favorite job as a nurse, actually, even though I do have the advanced degrees, I love being a nurse. I genuinely love being at the bedside because 1, it's a form of socialization, but 2, it's an interdisciplinary way to learn from everyone else. I actually have my lifelong friends, best friends. We are scattered all over the hospital, all over the country, because of what we accomplished as nurses. But you know, like when you're in the supermarket and you're like, what's wrong with that person? What's going on? So it's more of like it's a way for everyone to connect with each other. The hardest part about nursing, for me, just from a personal experience recently, is when people are intolerant of those who are new to the profession. The hardest part about being a new nurse is being told, they're new, they don't know any better. Oh, they're new, do this. No. Every single nurse is taught the same way in nursing school. We are taught to, if that was your family member in that bed, would you trust your classmate to take care of them? And for those of you who are in the audience, who are my students, you've heard me say that. So that is one thing that I really push forward, and that was one of the best things I taught, even when I was a nurse preceptor, even as an educator, and even as someone who is here with all of you today, is that's the one part of nursing. You will one day end up with a family member or yourself in the hospital as a patient and wonder, is this person going to be taking care of me because they have the time to take care of me, or is it rushed that they put me on the back burner? So that was the hardest part of my career, and being a nurse during COVID, when this hospital exploded, with the amount of beds that we had, and I think we did a fantastic job of taking care of our patients. I also had the highest mortality rate. And 2 years later, I have not fully dealt with what I saw. And it does come out at different times. So if I'm with the students, I'll be like, okay, this is why I am the way I am. It's because I haven't processed fully and healed fully from what I saw in the last 2 years. So it's something that we really need to focus on with resilience and with self-care, which is why I'm pushing that, is we go into a room and we're like, hi, it's okay, I'm going to be your nurse today. What can we do to help you? Meanwhile, you could be having the worst day of your life. So that is something I want to pursue with my students moving forward, because that's something that we really want to push for the future generations to take care of yourself. So it doesn't come out at different times in your life after you've been exposed to something.
So rewind back to maybe 1997. When you graduate from high school, when I did, and then you decide, where do I want to go to college? What do I want to be when I grow up? Remember I said I wanted to be a nurse? That changed during that time because every Filipino is a nurse, right? Every Filipino is a nurse. So I was like, maybe I don't want to do that. I want to be just like everybody else. But I think I want to try something different. So I keep Stony Brook not wanting to do nursing, but I wanted to be a teacher. So my grandmother was a teacher, so I think that's how that came to be. But sometime during college, nursing actually found me. I did all the prerequisites, to graduate, all the psychology, all the sciences, because that's general education, we need all of that. And then I had to take care of my grandmother who was in Arizona, and she had diabetes. She just had surgery, and I was, I was not working because it was the summertime. So I stayed with her a little bit, and I said, what, actually, I think I like this. So that's how I ended up nursing. But where am I today? I'm doing nursing education. So, I see all of the nice faces of all of our students here and the ones on Zoom, yeah. Yeah,
You become a teacher.
I teach for nurses. So, you asked, what is your favorite job as a nurse?
Right.
It is nursing education. So I love working with the students. I love being able to, have an impact on the way that you take care of your patients. Because now I'm not just touching the lives of the patients that I take care of, but I have an impact on how you take care of your patients. So, instead of touching the life of one patient, now I touch the lives of the students who have an impact on their own patients too. So I feel like, it's like a broader scope, but it's really nice. I love, just being able to mentor and teach new nurses, how to be the best nurses that they can be. So that's how we ended up here.
So, I ended up wanting to be a nurse anesthetist. Now, somebody who knows what that is you don't say anything, you don't talk. And I ended up, we were in rotation, and I ended up in the OR with a nurse anesthetist, and we didn't say anything. So I was like, I'm not gonna last you. So I didn't want to be a nurse anesthetist after that. So it was good thing about nursing school then, or still now, that they kind of expose you to that. But I didn't realize that I was gonna love community nursing so much that I did it for 20+ years. So I worked for the Department of Health as a public health nurse in the 90s. And I always tell my students that my COVID was HIV. Yes. I took care of all of those HIV patients who were dropping like flies because we didn't know how to take care of them. And when COVID hit, I was like, oh my God, this is HIV all over again. And now, remember guys, HIV is a long-term health issue now. It's not short anymore. They don't die within a month or two. They live for years and years with all the medications that they need. And I'm praying maybe with COVID that happens as well. But yeah, no, I love being out in the community. I love talking to patients and families. And the fact that I can go back. So that was the thing I didn't like about the hospitals. If they leave and you're like, oh wait, what happened to them? I need that. That's like the type of personality I need to make sure I know that you actually followed what I said that you were supposed to. And a lot of times in community, it takes like 6 months, an average of, for them to actually follow what you're telling them to do. You gotta keep going and repeating and seeing them like on a weekly basis, So, yeah, no, I did not become a nurse anesthetist. I became a public health nurse, and to this day, I am still out in the community and still seeing patients, and I love it.
It's beautiful. Alright, so we're moving to our next topic, which is about crisis points that are experienced by our nurses. And before that, I wanted to read again from the ProPublica article, the 2020 article by Nina Martin and Siam. And this is a quote from the article. Today, people of Filipino ancestry comprise about 1% of the US population, but more than 7% of the hospital and healthcare workforce in the United States, or nearly 500,000 workers, according to the US Census, find themselves in the healthcare profession. They find themselves fighting not just a potentially lethal illness, this is really important, of course, but the scapegoating stoked by President Donald Trump and supporters who have taken to calling COVID-19 the Chinese virus. Since late March 2020, civil rights organizations have received nearly 1,500 reports of anti-Asian incidents, mostly from California and our own state, New York, including against Filipino Americans. And this is a quote from filmmaker, Emmy Award-winning filmmaker Larissa Aroy, who is a dear friend, and also the daughter of nurses. Her parents were in the healthcare profession. And she said, this anti-Asian racism that's happening right now, Aroy said, what it makes me want to do is scream out, how dare you treat us like the carriers? We are your caregivers. So this is from the article. So now we're moving to this next theme of crisis points or your experiences during the pandemic. But also the most recent event that was very historical for nurses, which was the 2023 spring nurses strike. So a question is, how did COVID-19 impact your experience as a nurse? And also, maybe if you can talk about whether you were part of the strike, what was your opinion about the nurses strike that, of course, ended successfully after 3 days that benefited new contracts for nurses. So.
I'll go first. I think that's fine. So, as far as COVID, being in academia for a while, I've been out of the bedside. I stopped working at the bedside in 2016, which is very pre-pandemic. So I wasn't working, with patients, but I was working with students. I live in Queens, Woodside, Queens, which is close to the epicenter of the pandemic. It was really hard for me during that time because my family, I got sick. My father got really sick. He almost didn't make it. He was in the hospital for about 2 months. Thank goodness he's still with us. And, thank you to one of my close friends who was actually his attending physician, who's also Filipino, who was taking care of him, checking up on him every day, calling us every day, just to, let us know, because it was a really hard time. But, living in Queens, especially during the first wave, was very hard because all you could hear every second of every day is ambulances. I live very close to Elmhurst Hospital, which, you could always just frequently hear the sirens going off all day, all night. And, I was really sad that I couldn't work with patients and I couldn't do more to help, like I wanted to help. But the good thing about Stony Brook is that we had opportunities for our nursing students. Everything shut down for a while. We couldn't do anything. We were doing Zoom, classes online on Zoom. But we were able to turn it around so that the students could actually vaccinate, the community. And the students were actually all the ones who work in the hospital to take care of non-COVID patients who also needed help. So, that was, I guess, the silver lining about, being in academia during COVID.
So, again, I was not part of the COVID era as well. I actually work 3 days a week now online, and I see patients 2 days a week live in person. And so my job kind of didn't change that severely. And I was not part of the strike, but I completely support what they went through, and I'm so glad that that was resolved rather quickly. There's still a humongous amount of nursing shortage, okay, in the US. So we definitely need the students to graduate soon and help to do so much, so much work again in the hospital setting or in the community. So pretty much I support any kind of nursing and all the nurses and students as well, so.
I'm actually one of the newer instructors at the School of Nursing, so I was a pandemic nurse. I was not school nursing yet. I was an adjunct instructor. So I actually worked upstairs in the COVID ICU for all of 2020. Yay, happy birthday to me. I walked right there in front of the hospital, closed to all visitors. So I walked in and I was like, this is gonna be interesting. We thought maybe a week, maybe 2 weeks. The first admitted COVID patient to this hospital came to our unit. We had no idea. The second COVID patient I was assaulted by. Was a rapid response from the floors. We had no idea what happened. It took 4 of us to pretty much restrain this patient in order to get a breathing tube, which would help save his life. I did have to go to the ER to get evaluated, and with defense wounds all over me. Did it change the way that I took care of this patient? No. Had no change at all. Because I will take care of every single person I have assigned with whatever care that I can provide. However, each room would slowly turn into an isolation room. 1 floor, then 2 floors, and then it turned out 7 floors with ICUs in this hospital would have been converted over. The thing is, we don't have any nurses, and as a critical care trained nurse, I volunteered to go up to COVID ICU. My mother, who she's now retired, was a pandemic nurse in Brooklyn. If anyone is familiar with Crown Heights, they are one of the epicenters down by downstate, which will have the highest mortalities of nurses in the tri-state area. She is a chemo tuition person, and she is a cancer survivor. She went to work every single day she was supposed to go to and said, if you do not go give me PPE, I will not come in. That was her one condition of her going to work. She went 90 minutes left, I went 90 minutes right. I did not see my family for 3 months. And then it turned into 6 months. Checked on them, my family. My sister was a resident of upstate New York. They had no idea what COVID was. So it was very interesting to see how different the 3 of us were. My sister was the only one who ended up getting COVID during the pandemic. I did not, my mother did not. My father is an engineer, so for all of my Filipinos watching, you're probably laughing right now, but yes, my mom is a nurse, my dad is an engineer. But none of us got sick. So the reason why I ended up coming down towards the end of the year and was given this opportunity to teach the future nurses, because I watched the new nurses who had just graduated in 2019 get thrown into this. They were terrified, they were scared, they had no idea how to take care of a patient, much more now a patient with a disease that none of us know about. So that fueled my passion to want to educate these people who are coming in, who genuinely want to help people, but not be afraid to do it and not be afraid to take care of all these people who are coming in through the door. Especially because I had no idea who we were going home to at the end of the day. But it was why I became a huge advocate for PPE. I am very strict with masks in class. I don't know who you're going home to, but also why we needed to protect ourselves, because we also forget that just because you tell one family not to visit another family, what's a big thing that brings people together is food. An entire floor ended up getting COVID because one person had the meal van from church and drove from house to house to house. How do we tell someone, please don't do that, when that is your culture that you are bringing in? So we saw a lot of families and a lot of people who went to the same community churches pass away because they didn't know not to do that. So from the perspective of someone who was a COVID nurse and then bringing that forward from an educational standpoint, we had to become more inclusive of what other people's cultures were during the pandemic, but also how to educate future health professionals on how to take care of patients coming in and you have no idea what's going on.
Okay, there are some questions that we might go back to, if you might want us to cover them. I think we'll have some time for Q&A, so in case we didn't, answer questions that are interesting to you, please feel free to ask that. All right, so we are moving to, I think that this is actually going to be, close to our, last, question. Which is the profession in the future. Nursing profession in the future. But before that, again, some data I wanted to share, and this is from the National Nurse magazine, which is the voice of National Nurses United. And this is, of course, an article on the 2023 New York City nurses strike. I just wanted to read this from the article. This is a quote from the president of the New York State Nurses Association. This is the NYSNA president, Nancy Higgins, who is an RN. And here, this is a quote: "With their historic victory, NYSNA members at the Montefiore, Bronx and Mount Sinai Hospital sparked a national movement with wall-to-wall enforceable safe staffing ratios to make sure there are always enough nurses at the bedside of every patient at every hospital across the nation. Although it will take time for nurses and patients to fully implement its victory on the hospital floors, change begins now. The new staffing standards in our contracts must now go to the New York State Department of Health, work, Maria, and will become the new staffing standards to be enforced by law as well. These improved standards won't just be on paper because nurses want concrete enforcement, including expedited arbitration and enhanced remedies, including potential financial penalties for the hospital if they fail to follow the staffing ratios." Okay, so some good news from spring 2023. So now our last theme, which is on the profession in the future. And some questions I'd like the panel to answer. Would you become a nurse again if you had the chance? And if you could discuss advice for those in the audience on Zoom and here, advice for future nurses.
Yes. So definitely, again, like I said before, the thing that I love about nursing is I can try so many different parts of nursing. So, the number one thing that I'm going to advise to you guys, the new graduates or the future graduates, is that don't stay in a unit where you don't like it. Please, you're going to make your patients miserable. Okay, a miserable nurse is a miserable patient. So please, don't let me go over there in the unit where I take my students and you're pouting or not smiling. You don't have to smile like this all the time, but please don't be miserable. There's so many different aspects of nursing that you will find. You may not find it in nursing school, but you do find it eventually, but don't stay in one spot. Okay, that wasn't the old thinking, I believe, like my old aunties, they've been there for like 5, 6, 10 years, right, and they never changed. Now the students are actually, or the new nurses are actually saying, all right, you know what, I did this for a couple of years, I'm gonna try something else. I'm gonna try this, I'm gonna do that. So that's the greatest thing about nursing is that you can try so many different aspects of nursing. So, if you have one thing that you can remember here is that, again, pass your boards, be a nurse, but don't stay in one spot that you're not happy. Be where you're happy because you have to make the patients happy. Okay, that's your number one. Yourself first, and then it comes back.
Don't be a crab apple. However, the one thing that for the pre-licensure students, a lot of people go into nursing school, I'm gonna do this because this is what I wanna do. don't do that. Don't do the tunnel vision. Open your eyes to everything, because I thought I was going to be a psychiatric mental health nurse, OB or peds. I did the rotations and I was like, this is not for me. But I actually ended up in ICU. The one unit I didn't want to end up on because my mom is an ICU nurse. And then I got exposed to it. And I'm like, you know what, I kind of like this. I'm very good at like organizing, but I also micromanage what I put in front of me. So if I have a patient and 2 patients in front of me and I can do all the math and do all the medications and etc. and take time to figure out what's going on with them, that's the type of person I am. But pediatrics and psychiatric mental health were very difficult for me because it was one of those things where I got very attached to patients. And that was very hard for me to disassociate over time. But now I'm seeing a lot of students come in and like, this is type of nursing I want to be, this is the only thing, but close the doors on everything else. And I ended up actually also being a community health instructor first, before I actually went over to Professor Blanco's course. I was actually her instructor after, and I was able to go to adult daycare because my background as a nurse practitioner was I did subacute rehab and adult daycare medical practitioner checkups. So I would make sure these patients were okay to stay in the outpatient setting because the goal is to keep your patients outside the hospital. So that's one thing that I also wanted to push forward with our students. Is life doesn't start and stay in the hospital. Life happens outside of it. For multi-generational homes, it is very devastating to see your grandmother or your grandfather or elderly family in the hospital. It's a very difficult adjustment because we don't bring food in that they like to eat. My father, who was recently hospitalized, ordered chicken every day, and I was like, I wouldn't want to eat that. It's one piece of chicken. What does he ask for when he sees my mom? I want canola. What's the main ingredient in canola? It's chicken. But you can't, it's not served the same way in the hospital. So my goal also for those who mentioned have me is to keep your eyes open for outside the hospital.
It's a Filipino tradition that canola is the medicine.
That's ginger chicken soup.
My story is a little bit similar but different from Sophia. So my mother came to the United States in the 1970s as a nurse, and that's why we're here. But she worked in med-surg for more than 40 years. And I said to myself, I do not want to do med-surg. So a medical surgical nursing. So it's, you know, a general unit. You take care of patients right after surgery or just for general medicine issues. So I didn't want to do that, and I wanted to work in the ICU. So, you know, you will graduate from nursing school, and then people will tell you you have to do 1 year of med surg first. No, you do not. Do what you want to do, because then you don't want to be forced into doing something that you don't want to do, because then you know what? It might drive you away from the profession. And you know, just always think of the reason why you wanted to go into nursing, and that is the reason that is going to keep you. Melissa, you asked about the future of nursing. So many of my students know that I have a daughter. She's 9 years old, and nursing has been part of her life ever since she was born. I started working here in Stony Brook when I was pregnant. So she comes to school all the time, and she wants to be not a nurse, but she wants to be a nursing professor.
Like mom.
But who knows? I'm not gonna force her, just like my mother did. She did not force me to go into nursing. She left it up to me to decide what I wanted to do. And I said nursing, and she's like, what? Are you sure? But but nursing has always been a part of my daughter's life. Remember I said that I wasn't in the hospital during COVID, but I can guarantee you every 7 p.m. me and my daughter were outside with our pots and pans and our spoons and bells cheering for the nurses, cheering for all of the healthcare workers at 7. So, I'm hoping that, it will leave a lasting impact on her, because she will be the future of nursing as well as, our current students. You will be the ones to take care of us when we get old, which we are getting old.
3 years from now. 30 minutes. And so I wanted to So you can.
Yeah. I'll grab it.
Yeah, we would love to get questions. There are people on Zoom who can they type in their questions or no?
Yes, we received a question via the chat about like how to succeed in the academic and clinical realm of nursing, but I think the panelists answered that. But if the person who put the question in the chat could maybe ask, maybe clarify which portion they'd like the panelists to focus on, because I think that last section of the panel really discussed the academic and clinical how to succeed.
But I would like to ask the panelists, it sounds like you're all really strong-willed women. That's very common in, I think, from what I hear from everybody on this panel, which is fantastic. And I think
It's in our blood.
It's in our blood, we're Filipino, and we're strong. Exactly. And I just wanted to maybe hear more about, you know, there's the reality that we are overrepresented in the nursing profession. But from the way that you are speaking about the profession, even if there were problems, and that's the reason why there was a strike, we still gravitate to this very good middle class profession. It offers Filipino immigrants a path to the middle class and better lives. And so maybe you would talk about just your sense of being Filipina, because it's Filipino American History Month. What does it mean for you that you are part of a profession that is quite demanding and also dangerous?
Well, being Filipino is, if you know Filipinos, we are a very kind-hearted, family-oriented, and we want to help everybody. So it's just part of being that. I guess it's in us. It's in our blood. It's that we, you know, my mom always, I mean, I always say it, and I always have our accents. Okay, I'm first generation here, so I don't have the accent, but I can make that. So my mom was like, "Oh, Joe, you have to hit that person over there," you know. So it's and everybody always laughs. But that's the biggest thing that I learned from my parents and just from my family is that you don't just ignore people. You gotta get up there and help them, you know. And I guess being Filipino, it's also part of our religion. We're all Catholic, most of us, and that's it's embedded in us. If we grew up like that, or I know I did. I mean, my parents volunteer to this day, and they go on missions constantly to the Philippines, to all parts of the world. And so, watching and seeing that and being part of that, it's just in us. It's like embedded in us. So, and nursing just fits right in. Being a nurse, you can't just do that. You have to help, or else you hear your mother and that. Oh, you have to do that, you know, in your head, or your grandmother, or somebody in your family that's like very verbal, and it's usually a woman. Filipino women are very verbal, very strong, so.
I have to say that I agree. You know, when you're a nurse, you don't stop nursing once your 12-hour shift ends. You're always a nurse, no matter where you are, no matter where you go. That's something that you're always gonna keep with you.
Everyone know Joe Boy?
No.
John? People think that it's making fun of Filipino nurses. People think it's making fun of how we are and how our representation is. I'm first generation as well. My mom, my dad, they crack up because they're like, that's exactly what happened. They will rub towards everything. It doesn't matter what you, it doesn't matter.
Things in our window.
It is.
Because that was so helpful for it. Towards everything. So my mom graduated nurses from the Philippines, came here in 1981. No, sorry, 1983. She hears this. I became a nurse many years later, but she will still tell me, we compare war stories and we're like, what are you doing in your hospital? I'm not through with you. And I said, oh, I'm sorry. She was a charge nurse for almost 40 years. I would never survive her because she is so strong as a woman, but also as a charge nurse. But she was taught that way in the Philippines. Okay, that was your family member in the bed. Would you not tolerate any dirty sheets, any tubing that was unlabeled, anything that was out of place, any blood in the wrong spot? You wash your patients every single day. I go to the floors now and I'm like, when was this patient last washed? That would never be tolerated. So when you see the cultural changes and the generations moving forward, they would be, my mom just retired. And so did all of her nursing friends who are now gallivanting all over Europe right now. I'm like, please, what is wrong with you kids? I'm like, I'm sorry. I'm sorry. But it's very interesting to see how nursing changes among generations, but with each successive generation, we are what our parents brought forward into us. That's why I am the way I am. Students who are here because of how my mother was, even though she worked 2 hours away from me, because I can hear her in my head. What are you doing? Sorry. Here. I may be 30-something years old, and she's like, same thing with my sister. That's what we hear. My sister's a physician. Always have that little angel there. What? You guys look at it.
We have a couple of questions in the chat, and if the panelists can choose to answer one or both of them, we have a couple of minutes left. We might go a little bit over if that's okay with the panelists. The first question is about how, with all the work that you have to do as a nurse, I'm paraphrasing, how do you take care of yourself? How do you practice self-care? And then also, what are your thoughts on travel nursing? Is it worth pursuing?
What's the last one?
Travel nursing.
So, I like massages. But I like massages. And you know what, the Chinese massages are they're cheaper, so I try to go like every 2 weeks. But, you know, at least once a month, you know, so that's the way and I do a lot of meditation as well. Yes. So if I had a really hard day, again, like I talk a lot, so I talk a lot for work too. So if I have a hard day, I'll just meditate and it'll be quiet, which is kind of healing. That means I had a hard day. But what was the second question for you, nurse?
Travel nurse.
Oh yes, my cousin is a travel nurse and he loves it. So I will say that I wanted to be travel. I want to try everything. So just now, I have not done nursing yet, so I want to try everything. I would only say I would love to do that if I didn't have damn kids. But they're almost out of the house, so the kids are nothing, they're great kids. But yeah, if you don't have kids, I would do the travel nursing because I think they're only good for like every 6 months or so. Depends on the contract. Yeah, depends on the contract. But yeah, no, my cousin loves it. He's been a travel nurse for maybe almost 5 years now. Loves it.
Something that we tell our students all the time is that it's important to have balance. You need to have balance between, you know, your work life, school life, your social life, and just, you know, being able to care for yourself. So, something else that's really important in nursing is that you have to have somebody to talk to, because you're going to have good days, you're going to have bad days. And you don't want to keep that all bottled inside. So what are you going to do? So you're going to go hang out with your friends, have a good time, you know, talk about, you know, just things. That way, you know, you keep your mind up over. But yeah, massages and spa. Yeah, we need it because, you know, you're always standing up, heavy lifting. You need to take care of yourself. Because if, you know, if you're hurting, then how can you take care of others?
I'm a millennial. I'm sorry. I apologize. Sorry. That is the one thing. I have 240 students. I learn all of your names, but I am surrounded by people all day. I just want to sit on my couch and watch this wine. A few hours so I can see how the other people in life live. Because now I'm like, I just question my life decisions every day. And now I'm like, now I don't. So that's one form of self-care. I don't recommend doing it all day because then you forget to eat, go to the bathroom, But the one thing that Lonnie said was you want someone to talk to. It was very interesting for the students who were in workforce. I had students do a reflection assignment. What were you willing to give up to pursue nursing? Nursing was only 2 years. The program is 2 years. You have your whole life ahead of you. Don't give up something that you love, whether it's something like an activity or something that you do. Social media, okay, you can cut back on that a little bit. But if you did something, you are not defined by the fact that you are a nursing student, or you're not defined by the fact that you're a nurse. You have a life outside of that. So if you get all of your nursing friends, let's just say in the future, and you all work on the same unit, and you go out to dinner, and all you talk about is your patients, there's something wrong. That means you are too focused on work. Like, what is my group focused on? Fantasy football right now. We're focused on the Britney Spears book. We're focused on other things. We're trying to start a book club, the Jada book. We're trying to get things outside of what we do in nursing, because I mentioned earlier, I do have a lot of post-traumatic stress from COVID, and I have not dealt with it. I should have. I jumped from one job, I resigned on January 8th, and I started the school nursing January 9th. I never healed from COVID. I actually ended up getting my second vaccine and came here sick. That's how focused I was on moving on. But I never took time to stop and think about why am I doing what I'm doing and how am I doing it. So to figure out what to take a vacation. Haven't figured that out yet, but watch Love is Fine.
But definitely have some kind of outlet, whether it's your friends, something that I like to do. I like to go eat out, like I like to try new things, or I like to travel, with my friends or my family. Love to take your mind off of the stress, because nursing is very stressful and it's easy to burn out.
All right, so we'd like to close the panel out, and if you have any questions, please feel free to put them in the Padlet, and we will share the Padlet and the recording with all the registrants. So please do that. It's in the chat. And so we will be closing out this Zoom for the people who joined us virtually. So thank you so much for joining us. For the in-person, we will be having a networking portion, and we will have food. So please stay around. Thank you so much for joining, and happy Filipino American History Month.